Week 1. Anemia is a global nutritional challenge affecting 1.8 billion people, with children under 5 and women of reproductive age being the most vulnerable. In India, it impacts 52.2% of pregnant women, 57.2% of non-pregnant women, and 67.1% of children under 5. Adolescent girls are especially at risk, with 65.7% affected due to growth demands, menstrual blood loss, and inadequate nutrition. Anemia leads to reduced energy, higher infection risks, and reproductive health challenges, highlighting the need for targeted interventions. Iron is a vital trace mineral essential for oxygen transport in the body. It is used to form proteins called hemoglobin in red blood cells and myoglobin in muscles, which stores and releases oxygen. About 70% of the body's iron is found in these proteins, supporting critical functions like energy production and muscle activity. Iron also binds to proteins like ferritin and transferrin, ensuring efficient storage and transport within the body. Each gram of hemoglobin containing about 3.34 milligrams of iron. In the human body, iron primarily exists in complex forms bound to proteins. These include heme compounds, hemoglobin and myoglobin. Hemoglobin is the pigment found in red blood cells that carries oxygen from the lungs to organs and tissues, while myoglobin, present in muscle tissue, accepts, stores, transports, and releases oxygen to muscle cells. Heme enzymes include hemaoxygenase, nitric oxide synthase, and non-heme compounds such as flavin iron enzymes, transferrin, and ferritin. Iron is vital for several key functions in the body, including oxygen transport, energy metabolism, neurodevelopment, hormone production, and immune function. About 2/3 of iron is found in hemoglobin for oxygen transport, while 25% is stored as ferritin in the liver, spleen, and bone marrow. It also supports enzyme functions critical for energy production and tissue repair. The body efficiently recycles iron, with transferrin ensuring its delivery to tissues. Since there's no active excretion mechanism, iron levels are carefully regulated through absorption and storage to maintain balance and prevent toxicity. Anemia is a condition marked by reduced red blood cells or a lower concentration of hemoglobin in the blood. This deficiency disrupting oxygen transport in the body. Anemia is not a disease, but a symptom of various underlying conditions such as blood loss, excessive destruction of blood cells, or impaired blood cell production. Causes range from nutritional deficiencies in iron, vitamin B12, or folic acid to genetic disorders, autoimmune diseases, or infections. Understanding these causes is key to effective management and treatment. Anemia is classified based on cell size. Macrocytic, normocytic, or microcytic anemia classification based on hemoglobin content. Hypochromic or normochromic. Iron deficiency anemia occurs when the body lacks sufficient circulating hemoglobin or by producing microcytic erythrocytes, reflecting long-term iron deprivation. It is the most common type of anemia caused by long-term iron deprivation. It mainly affects women of reproductive age and children due to factors like poor diet, infections, chronic illness, heavy menstruation, and pregnancy-related blood loss. The condition develops in 4 stages. Stage 1. Moderate depletion of iron stores without dysfunction. Stage 2. Severely depleted iron stores without dysfunction. Stage 3. Iron deficiency with inadequate body iron, potentially leading to impaired metabolism and iron-deficient erythropoiesis, but no anemia. Stage 4 is iron deficiency anemia, the final stage, potentially causing clinical damage, dysfunction, and disease. Anemia is classified as normal, mild, moderate, or severe based on hemoglobin levels, which vary by age group and gender. For example, normal levels start at greater than or equal to 11 grams per deciliter for children under 5 and greater than or equal to 12 grams per deciliter for non-pregnant women. Mild anemia falls slightly below these levels, while moderate and severe levels indicate lower hemoglobin concentrations, highlighting the need for timely intervention. These thresholds defined by WHO, guide the diagnosis and management of anemia across different populations. Thank you.